I'll be talking to you today about ovarian cancer. Once again, I'm Dr. Ahmed and I'm glad to be here. Every woman has two ovaries, which are organ of reproduction. They have to produce cell, which the sperm will fertilize to give birth to children. So when there is an overgrowth or irreversible growth of the cells of this ovary, it leads to ovarian cancer. Ovarian cancer is the 8th most common cancer in the world in women, and it is a silent killer. By silent killer, we mean that the symptoms are usually covered. People usually present when it is late. What are the symptoms of ovarian cancer? People with ovarian cancer can present with abdominal pain. The pain can be all over the abdomen. They can also present with abdominal swelling, which usually occur in the late stage. When there is this swelling, it is possible that they've developed what we call ascites. That is when there is water within the abdomen. They can also have early satiety. That's when they get full by eating very small food. There can be generalized body weakness. There can be unexplained weight loss and then dizziness. Lastly is the frequent or urgent need to urinate due to the pressure within their abdomen. What are the things that put us at risk of having ovarian cancer? As usual, they can either be modifiable, things that we can control, and non-modifiable, things that we cannot control. The ones that we can control include use of fertility drugs. People that use hormone replacement therapy in order to get fertile, such as IVF, have been shown to have increased chances of having ovarian cancer. Second is smoking, then alcohol intake, and also obesity. Lastly is not having children. So not having children, even though it is not something we all wish, actually increases our exposure to estrogen. When there is too much estrogen, the ovarian cells they get overdeveloped, leading to what we call ovarian cancer. So we are saying there are risk factors. Doesn't mean whenever people have this situation, they are going to have the cancer. What are the factors that we cannot control? First is age. Usually old age, above the age of 50 years. Then gene. There are some genes in our body that predispose us to having ovarian cancer. Then family history, either sibling, your mother, or any of your sisters that have ovarian cancer also put them at risk of having ovarian cancer. Then lastly is having a personal history of breast cancer. How do we prevent ovarian cancer? Ovarian cancer does not have a standard screening. However, there are things that we can do to prevent it. There is need to do a regular physical exercise. You need to keep an healthy weight, and also to avoid unnecessary use of hormone replacement therapies. Also, it is important to know your family history. If there is any member of the family that has any form of cancer, it is quite important to know this so as to ensure regular medical checkup in order to catch this condition early for easy treatment. Thank you for listening to me. Kindly like, share, and also follow my social media accounts.